share my screen. Tonight, our discussion will be about Chapter 12, which is students with severe disabilities. And this can be kind of a broad category because in and of itself, it's not one of the IDEA categories. It encompasses a couple of different things. And so we'll talk about that as we go along. We'll start with a little bit of the history of severe disabilities. Historically, and we've touched on this this semester, talking about a couple of the other disabilities, pretty much disabilities in general, but historically, those with disabilities, certainly those that are more noticeable, were those with those disabilities were often segregated, maltreated, or institutionalized, but beginning in the 1960s, children with maternal rubella resulted in a rise in a number of children with dual sensory losses. But also in the 1960s, deinstitutionalization began in the US. And so individuals who had been relegated to institutions were beginning to rejoin society in many ways because those institutions were being closed. So maybe they were being brought back to live with relatives or put into group homes. But many of those institutions, whether private or public, that had housed the most significant, those with the most significant disabilities for many decades, were being closed. And so those individuals were having to get accustomed to other kinds of settings in which to live. That's a good thing. We don't like to segregate our populations with significant disabilities, but one thing that does happen as a result of the closing of many of those institutions is that people who did not know how to care for individuals with that level of disability suddenly were being faced with that proposition of care at a level that they just knew nothing about. And so it was a little bit of a crisis across our country when those institutions began to close. The one that I know the most about is north of the Dallas-Fort Worth area here in Denton. It's called the Denton State School. And it is still operational, but much, much smaller than it ever was. And basically what's happening there is they're letting the population kind of age out of that institution. And so they do still have some people who live there, but most of them are elderly, and they have not taken any new patients to live there in a number of years. And so the population is just getting smaller and smaller and smaller without new people coming to live there, and the older people, of course, dying off, or many were taken back home to live with their families or in other settings. So advocacy organizations during this period of time, the 60s, the 70s, and forward, began to seek inclusion sorts of settings in schools and communities. And certainly the school setting is always open and available to individuals with significant or severe disabilities. And we're really talking about included in this group are people with both, and I thought we had this on a slide. Let me back up and see. No. Maybe we have it on the next one, maybe. People with deaf blindness, that combination of two disabilities, and we'll talk about that here in a minute, or what we call multiple disabilities, and here it is on this slide. So of those categories under IDEA, we've got these two different disability categories that really encompass these severe disabilities. So like it says here on the slide, because severe disabilities is not one of those 13 special education categories, it doesn't have a specific definition, but it does encompass the categories of multiple disabilities and deaf blindness. And so we'll talk about each one of these. So here's the legal definition under IDEA for multiple disabilities. And this first word, concomitant, means occurring in more than one category, concomitant, or occurring at the same time. Concomitant impairments, such as an intellectual disability and blindness, or an intellectual disability and an orthopedic impairment. So when you have multiple disabilities occurring at one time in the same individual, the combination of which causes such severe educational needs that they cannot be accommodated in programs solely for one disability. So the person has an intellectual disability, but they also have other things going on, an orthopedic impairment, or they've got blindness and an intellectual disability and an orthopedic impairment, or they have a speech impairment, an intellectual disability, and deafness, all going on at the same time. And their disability in those areas is so severe that they can't be accommodated in the school setting for just one of those disabilities. They need services for each one of those disabilities. And so that's why we have the category of multiple disabilities, so that we can provide services for individuals who have needs in more than one area at a significant level. We're not talking about people who have two or more disabilities that are on the more, I hate to call anything a mild disability, but more frequently occurring, what we call a high incidence disability, more frequently occurring, like learning disabilities or speech impairments, things that that happen more commonly and don't require so much support in the school setting. So a learning disability and maybe an articulation disorder, which would be a speech impairment. So a person that needed some help with their reading, they have dyslexia perhaps, and they also have a stutter. Those are two disabilities, but they don't fit this category, even though there's more than one disability. They're not so severe that the person can't be accommodated in programs solely for one of those disabilities. So there's a difference in the type of severity that we're talking about here. And then the other category that we addressed today is deaf blindness. And we talked last week about deafness and hard of hearing and blindness or visual impairment. And this is a combination of both of those. So here's the technical definition: hearing and visual impairments, the combination which causes such severe communication and other developmental and educational problems that they cannot be accommodated in special education programs solely for children with deafness or children with blindness. So the sensory difficulties that the person encounters because of their deafness or blindness is so significant that they need programming for both the deafness and the blindness. Now, the person doesn't have to be totally deaf and totally blind. They could have partial deafness and partial blindness, but each one of those sensory disabilities has to be significant enough that they have to have educational support in both. So how are students with severe disabilities classified? Well, most students with severe disabilities will need extensive, or what we might call pervasive, support. So this is not a condition that's going away anytime soon. It's a lifetime kind of an issue that's going to be around indefinitely, and it's going to be to such a degree that we would consider it extensive. Sometimes it might be that parts of the need are intermittent. Maybe health issues arise such that the intensity of the need gets worse at sometimes, and the need for more intensive support rises and lowers over time. But at times, it's so intense that a lot of support is needed. It might be time limited. The need for support during certain periods of time during life is really intense. It might be extensive. There's a very intensive support in one or more environments that's needed, or it might be what we call pervasive. An intensive assistance in more than one setting is needed on an ongoing basis. So what is the prevalence of severe disabilities? Well, fortunately, it's infrequently occurring. In the category of multiple disabilities, only 0.2% of our students aged 6 through 21 fall into this category. So about 1 in 500 of our school population would fall into this category. So in a typical school, maybe 1 or 2 children. In an elementary school, maybe only 1 child would have this level of disability. In a large urban high school, maybe 3 or 4. If a high school has 2,000 kids, maybe 3 or 4 students would fall into this particular category. Deaf blindness, also well below 1% of the school age population. So also infrequently occurring. So what are some of the causes of severe disabilities? Well, we can have a number of different causes. It's not always just one thing. It can be genetic or biological. We talked last week about some of the genetic causes for deafness and blindness, or partial deafness or partial blindness. And so those same factors can be present in today's discussion. It could also be something like fetal alcohol syndrome, other syndromes. We talked a little bit last week about Usher syndrome and Pendred syndrome, other things like that that have a genetic or biological origin. Other viruses and infection. We talked just a moment ago about maternal rubella can cause some of these kinds of things. Sometimes it's an infection, such as encephalitis. Rubella, as I mentioned just a moment ago. It can be environmental. So you could have trauma at birth. Perhaps the birth process causes birth issues, birth defects that would not have been present if the birth process had not had trauma involved. Can be things that occur after birth through poisoning or accidents. It could be a lack of nurturance or health care, other things that occur because of negligence or just what we might call a failure to thrive in a newborn, or early intervention. A lack of early intervention may contribute to severe disability. So we've got lots of possible causes. And sometimes we just don't know what all of those are. So what are some possible characteristics that we see in students with severe disabilities? Well, some have diminished cognitive functioning, or that's what we would know as IQ or thinking ability, affecting abstract thinking, learning, attention, memory, all those things that are necessary to be successful in school. The individual may have significant physical needs. They may have health issues. They may have communication problems. There may be significant developmental delays, like I mentioned a moment ago, including speech problems, personal social skills, so not learning to do those basic things that we would expect a person to be able to do as they develop and grow. There may be behavioral issues, motor issues. It could be gross motor, large muscle movement, or fine motor, which is small muscle movement, more of the hands. It can be have to do with the learning or attention, memory, mobility, of the ability to move around, get from place to place. Difficulty learning self-care skills. So can the person feed themselves? Can they toilet themselves? Can they dress themselves? They may have a need for repetition to acquire skills. So we've got a lack of generalization, maybe difficulty in transferring skills from one situation to the next, and requiring a lot of practice and repetition in order to acquire a skill and then to generalize it to another setting or environment. So how are students with severe disabilities identified? Well, with most of these significant or severe disabilities, identification is made at birth or shortly thereafter by a physician. Sometimes it's even made before birth. If we've got genetic issues going on or things like that that can be determined in utero, sometimes these things are known months before a child is even born. But if not, then we've got neonatal screenings that occur. Some are happening in the delivery room, others are happening before the baby ever leaves the hospital. And we know a lot of these markers for the various earliest development before a child even leaves the hospital. If these things don't show up then, we would expect them to show up in those first few doctor visits after a child is born. And we've got usually the first doctor visit comes at 2 weeks, and then usually every number of weeks after that until we stretch to every few months. And we would expect most of these kinds of things to show up over that first year of life, certainly, as babies begin to hit those developmental milestones. Are they holding up their head at the right time? Are they rolling over when we expect them to? Are they sitting up? All of those are those developmental milestones that we expect from typically developing children. And if they are not hitting those milestones, then we begin to investigate to see if other things are going on. Communication disorders may be diagnosed by a speech language pathologist really actually quite early, because we expect children to start babbling by the time they're 6 months old. And those first sounds, not necessarily words, but those first phonemes usually are made in the first year or so of life. And we talked about that when we studied speech language disorders a few weeks ago. So what are some common assessments for school-age students with severe disabilities? Well, the IQ test is one that may be assessed for school-age populations. And that's something that I did for years and years and years in my professional life. It's what I do with most of my time here at Tarleton, is I coordinate the master's program for educational diagnostician certification. And those are people who are seeking to get a master's degree beyond their teaching credentials. And they help the school in determining the presence of disabilities in children. And the IQ test is one of the most basic building blocks of coming up with a diagnosis of a disability in a child. So the IQ test, and then we do some achievement testing to determine if the child is on track developmentally. So we want to look at intelligence, where the child is as far as their learning and memory, some of those kind of things. And then we also have what we call adaptive behavior skills, where we compare the child with other children of their same age with the things that they know how to do and learn how to do in the community, in the home setting, in the school setting. Are they on track developmentally with their peers? And then dynamic assessments are the things that we do where if we are to observe a child in maybe a play-based assessment, something like that, or we interact with them, or we do observations of them in more of a real life setting as opposed to a clinical setting. So what early childhood assessments may be used with children with severe disabilities? Well, like I said a moment ago, the medical evaluation is going to be critical to making some determinations as to whether or not a child has one of these genetic disorders or some other kind of a developmental issue that's impeding their proper growth and development. If they've got appropriate hearing and vision, the medical evaluation will tell us that as well. The communication evaluation, you're going to have a screening for that when the child sees their pediatrician. But as they continue to develop, if that's not on track as we would expect it to be, then an evaluation by a speech language pathologist can take place before their 3rd birthday through early childhood intervention. And that's a federal program that's available to the public free of charge. And the child would be able to get some speech language therapy in the home setting before they ever come to school. And then there's a kind of a bridge between the early childhood intervention and the school setting, where the child starts getting those services at the school, in the school setting, when they turn 3. Transdisciplinary evaluations, that's where we work together across disciplines, and it might be communication through the speech language pathologist. It might be with a physical therapist, an occupational therapist, maybe an autism specialist, a school psychologist, other particular specialists, or those that have a skill in one area over another. And we get together and we compare our notes, and we collaborate to come up with an evaluation. We would include the medical folks in that and get their information, and put that all together to come up with an appropriate diagnosis for the child. And then what are our plans to help remediate whatever the difficulty is. And then sometimes we also incorporate an assessment of family functioning. How can we take the evaluation that we've done and include in that what's going on at home, and help the family to be a part of whatever we need to do to improve the child's functioning in the school setting. So how are individuals with deaf blindness identified? Well, if you remember what we talked about last week in our analysis of deafness and blindness, we take those 2 components and we combine them. Audiologists assess hearing. Loss at 40 decibels or greater represents a significant hearing loss. Ophthalmologists or optometrists assess vision or visual acuity. 20 to 70 in the best eye with the best possible correction represents low vision. And IDEA, our Individuals with Disabilities Education Act, only requires a combination of hearing and vision loss that requires special education, not that the child be legally blind and deaf. So just a portion of either one of those sensory difficulties will qualify the student for services under deaf blind. Now, the way I remember deaf blindness the best is to kind of put a hook in my mind about Helen Keller. Helen Keller was certainly kind of the poster child for deaf blindness. I think she certainly had a pretty profound hearing loss. I don't know how, I can't remember. I've read the book of The Miracle Worker, and I've of course seen some of those movies that have been on off and on through the years about the Miracle Worker, but I don't know exactly how blind she was. I don't know if she was totally blind or if she just had partial sightedness, but I was thinking she was totally blind. And if so, she would be a pretty extreme case for deaf blindness, but also a good example there that she had her cognition, her intellect was totally intact. And I believe she went on to be a teacher, if I'm not mistaken, herself. I'm just kind of recalling that from the recesses of my mind. I'm not sure about that, but she certainly was a well-spoken individual later and had a lot to say about her condition. And we know for a fact that she was not intellectually impaired and was able to learn a great deal despite her impairments with her hearing and her vision. So what should I teach students with severe disabilities? And we're coming at this all from a general education perspective. So what should general educators expect? Well, if we're talking about students with deaf blindness, we expect that most likely their intellect is intact. And so their ability to learn grade level curriculum would be that of other children. We're just looking at a question of access. So how do we get the information to those students? That would be our primary concern. And with most of those students, it's going to be an issue of technology. How is technology going to help us get the general education curriculum to students who have sensory difficulties of hearing and vision? And there's lots and lots of technological kinds of things that are going to make that accessible to students. And so you may see some students like this in general education, but like I said a moment ago, there aren't very many of them. And so their appearance in schools is not common. And so I wouldn't expect to have a lot of children like this in your teaching career. On the other hand, we have students with significant disabilities of other types where you have this overlap of intellectual disability and physical disability, or communication disability, orthopedic impairment, and traumatic brain injury, where you have several of these other disabilities overlapping. Oftentimes with those, an intellectual disability is primary to the disability itself. And when that occurs, then accessing the general ed curriculum at the same level as the rest of the peers in the classroom becomes more of a challenge. When an individual is not functioning at the same level as other students intellectually, and the curriculum is not just a matter of access, it may be a more of an issue of modification of the curriculum is going to be necessary, not just adaptations or accommodations, but actual modifications of the curriculum. So as you see here on the screen, access to the general ed curriculum should be available from early childhood all the way up through graduation for all students with adaptations as needed. For those students with those more significant, severe disabilities that impact intellect, functional skills may also be needed and identified through what we call here ecological inventory. So where we do some assessment to see what they're actually able to do and access, and what's the most appropriate set of goals and objectives for them out of the general education curriculum. Maybe a functional behavior assessment might be necessary to see what are appropriate goals for them in your classroom. And some alternate assessments. How are we going to access the curriculum and then assess their success in the curriculum? So what are the most important goals for that student throughout their school day? It might be self-care. Can the student successfully feed themselves, toilet themselves, dress themselves, get themselves up and down the hallway and in and out of classrooms? Is the question cognition? Some individuals might be significantly impaired with those self-care skills, but cognitively, they're very present. I had a student a few years ago who had cerebral palsy so significantly that he was, not only was he in a wheelchair and had no control over his physical movements at all, but cognitively he was right on target. And so our goal was to see how he could access things and communicate his needs and his growth through the curriculum to us. Those were the challenges that we had, because cognitively he was very aware and able to work through the curriculum. It was just a matter of making sure he was accessing it appropriately and had an ability to convey his knowledge to us, despite his difficulty with traditional communication methods. Motor skills may be the problem. Communication may be the issue. The student may need a communication board where they can communicate by, tapping on symbols or letters or words to get their message across. It may be a matter of mobility, getting around the school, getting from class to class. It may be the need for a wheelchair, or it may be the need for a stander, which is a frame that helps the individual get upright in a standing position, or being able to integrate themselves with other students in the classroom in a more appropriate way physically. Social interaction may be the problem. That may be the primary goal for a student, perhaps, who is functioning at a lower level intellectually. Maybe social interaction is the primary goal. And also, what we want to be focusing on is what's next after school. We want to prepare students for transition to adult living. And so for some students, that's our primary goal. That's our main focus, is to get to that point where the student makes that transition to adulthood with as many skills intact as possible that they're going to need for adult living. So how should I teach children with severe disabilities? Well, often learning skills will require more time and repetition, as I said a moment ago. Sometimes lots and lots of repetition. Sometimes just the act of expressing oneself is tedious and time consuming. If the individual is using a communication board and needs to maybe they've got a pointer, maybe they've got a pointer on a headband, and they've got to use that to communicate on a board. Maybe it's eye gaze, and they've got a computer screen, and it's sensitive to where their eyes land. And as long as they're gazing at a particular symbol on the screen, it's picking that up. But if that's the method of communication, that can take a while, and that can be tedious. So perhaps they just need more time to learn skills, to communicate their needs, to communicate their progress through the curriculum. Maybe it's an issue of repetition in order to learn a skill. Sometimes, well, always, we need to base our instruction on the student's individual needs. So the IEP, the individual student's educational plan, needs to drive all of our instruction. It certainly does when the student is in a special education setting, but if they're in the general education setting in your classroom, that may be the place where some of those goals and objectives are being met. And so you need to be in the loop on what their IEP says and what the goals are for your classroom. Adapt the general education curriculum goals and objectives accordingly to what the student actually needs in your classroom. We want to teach chronologically age-appropriate skills. So we don't really want the student who is high school age to be watching Barney videos, if we can avoid that. We want to have them doing age-appropriate things with their peers. We don't want to have students, doing color sheets and dot to dots and things like that when they're sitting in a class with their same age peers doing higher level skills. They can do a modified assignment without it being a preschool assignment. It can still be age appropriate. We want to provide as much opportunity for participation as possible in the general education curriculum. And that may just be partial participation, but we want to give those opportunities as broadly as we can. We want to use those naturalistic teaching strategies. So making opportunities for them to join in with their peers. We want to work closely with paraprofessionals and family members to give the student as much opportunity as possible to have a typical and fulfilling educational experience. So what are considerations for the instructional environment? How does that impact the student with significant disabilities? Well, students with severe disabilities and peers without disabilities can both benefit from that inclusive education. We want to provide as much opportunity as we can for peer interactions. I've had a lot of students in my classes through the years who have benefited from and participated in programs in their schools growing up where they worked with individuals with disabilities. Sometimes it's in a PE class, sometimes it's through a circle of friends or a buddy program. Lots of opportunities like that in many schools these days. Sometimes the more formal programs are limited to secondary schools, middle schools and high schools. Oftentimes it's high schools. And sometimes students even get credit for being in those programs. General ed students get credit for being in those programs with special education students. But sometimes I think students can benefit at a much younger age from those same kinds of programs. So if we start kids out with those opportunities in elementary school, then they're not so shocked by the presence of students with more significant disabilities when they're a little bit older. If those students are integrated into their classrooms, into their out classes, their specials, band, music, art, PE, whatever the special class is, opportunities in the cafeteria, things like that, then it's not so shocking when they see somebody who's in a wheelchair or who looks a little bit different, who has a feeding tube or whatever the situation might be that sets that student apart a little bit. If those interactions begin when they're young, then it's just not quite so different and noticeable to them. As students get a little bit older, we want to use community-based instruction wherever possible. Sometimes that's a work environment where the student can learn on-the-job skills. We want to give them opportunities to access public transportation, to go to McDonald's and learn how to order a hamburger, some things like that. Go shopping and practice making a purchase at the Dollar General, some things like that, and get those experiences. We want to provide needed supports in all environments. We as a school, public school entity, also offer supports to families and parents. We do in-home training as a related service for special education. So we go into the home and help parents learn how to take the skills that the student has learned at school and transfer them to the home setting. We also do what's called parent training as a related service, so they can maybe get some specialized training just for them and what they need to be doing in all settings with the student. And we want to adapt according to sensory needs. Sometimes kids have a real sensitivity to light. Maybe they need some specific positioning, maybe some specialized seating, technology, grouping, etc. And then what types of instructional technology can be used? Well, we want to choose technology that helps the individual perform the desired skills in the most effective and efficient manner. And so it may be adaptive equipment needed for feeding, dressing, or toileting. So equipment that helps the person to do what they need to in a particular environment. It may be alternative or what we call augmentative communication aids. So what we supplement the environment with to help that person. And then it may be what we call assistive technology based on the needs listed in the IEP. So technology is our friend in special education. We've got lots and lots of things that we use to make the learning environment more friendly for students with disabilities. And it's particularly necessary and needed with this population of students. And it can be as complex as a motorized wheelchair or a lift system that gets the student out of the chair and onto the toilet or onto a changing table or at home onto onto a bed or into a bathtub or something like that, or as simple as a pencil grip. All of those are assistive technology devices that we use with students. And so whatever is appropriate, we've got specialists that can help us determine the most appropriate, the ones that help and the ones that just hinder, and those that make the school day run more smoothly for the student, and help them in their lives as well. So what are some considerations for the general education teacher? Well, we want to welcome all students into the classroom. I think some teachers never conceive when they first get started that they'll have a student with an abundance of needs sitting in their room, that we all picture typical kinds of kids filling up all those desks. And we don't think about kids who might have an abundance of needs, that might make strange noises while they're sitting in our classroom, or need a paraprofessional sitting next to them the whole time, or need to be taken out of the classroom for a while to get fed through a G tube in their stomach, or have a seizure during class, or all kinds of strange things like this. We don't think about that when we imagine ourselves as teachers at the front of the room. But those are part of our classroom. They're students just like everybody else. And so we want to welcome them and make sure that the other students understand that they are a part of the fabric of our school and of our classrooms. We want to show concern for the success of all students, regardless of their level of achievement. And then we want to willingly adjust the classroom and the learning environment to meet the needs of every student. We want to implement those adaptations and instructions to meet individual needs, and be really open and welcoming of those adaptations and instructions. Select effective teaching methods and materials that are inclusive of all children. Be sure to collaborate with special educators and parents. Remember back to chapter 3, the things that we discussed about collaboration, and how we work together and not get in our little silos and just think about the one way to do things, but work together with all those specialists and families. And then assess effectiveness of instruction for students, and then be willing to make changes as needed. And that is the end of our PowerPoint tonight. A couple of things beyond this. Our Unit 3 test will open up tomorrow. I might just go ahead and open it tonight while I'm thinking about it. And that will be available through Sunday. And it will be just like the other tests that we've had, like Unit 1 and Unit 2. It will cover chapters, I believe it's 7, maybe it's not 7, 8, 9, 10, 11, 12. Not sure now. Nope, maybe, I'm not sure. Have to go back and look. Anything that's listed under Unit 3 is in the test on Unit 3. And then maybe it starts with 8 and 9, 8, 9, 10, 11, 12. That may be it. Not sure. Y'all have to look. And it'll be open through the weekend. I also told you last week about that third application activity, which has to do with a movie. And I really enjoyed looking at your books that you did for application activity number 2. A lot of cool books that you all put forward for that. So have fun with the movie assignment. And maybe some of you will watch Coda, that won the Best Picture Oscar on Sunday night. I thought that was a cool honor for a really fun movie. It's got a great story too. It's got a good little love story. But it's a good movie. And if you get a chance to see it, it's on, I believe it's on Apple, maybe it's Netflix. Can't remember. Maybe it's Apple TV, but I'm sure some of you have access to that. But if not, there's a ton of others. And if you need a title, just send me a message and I'll give you a slew of titles that you can choose from. Or you could probably Google disability in films and get a bunch of them too. But make sure that you look at the criteria that I want you to have included in your activity, the things I want you to talk about, and hit all of those. And make sure you give me a rating at the end. So test coming up, finish activity 3, and then we just have a few more chapters. We've got one more big assignment that comes up at the end of the semester. It's called our instructional materials project. And it's where you choose an activity, create that activity, create a PowerPoint to describe the process of creating that activity and how you would modify that activity for students with a disability. And then you present that in a video format for me and turn it in. So I will probably post 1 or 2 for an example of what a good one looks like. And y'all can start thinking about that. They're not due till the end of the semester. We don't have a cumulative final. We have a unit test 4, and that instructional materials project is due at the end of the semester as well. So those are the things we still have to look forward to. We've got 3 more chapters in the book. Chapters 14, 15, or 13, 14, and 15. And then we've got an extra activity on diversity. And then our instructional materials and our chapter. We've got a application activity on giftedness that we'll do for unit 4. So that's what we've got for the next few weeks, and then we'll wind this thing up. So I made a pretty big dent in my grading over the weekend, and I'll try to stay up with it for the next few weeks. So y'all get your part done and I'll try to get my part done. And if you've got any questions, shoot me an email. And Hannah, do you have any questions before I close this out tonight?
No, I'm all good.
All right, sounds good then. I'll say goodbye for tonight and I'll see y'all later. Bye-bye.